Hello there, I'm Dr. Soumik Chaudhury, consultant cardiologist at Peerless Hospital. There is a common misconception among people that the only disease that affects the heart is the heart attack. You will feel chest pain, you will have shortness of breath, maybe some amount of vomiting or pain radiating to the left arm. And that is the only symptom you should go to the hospital for. But that is a wrong conception. The heart is an extremely complex and an extremely delicate machine. It has a number of diseases which may affect it, the heart attack being only one of them. The disease that I would like to talk about today is something very different from them. It is the electrical disturbances of the heart. There are times we have had patients who have come to us with a history of giddiness. They feel that they are getting slight amount of dizziness or vertigo, and sometimes they even feel they are blacked out for a very short period of time, maybe 5 to 10 seconds. They tend to ascribe it to the stress of life, maybe they haven't eaten well, and they generally think it's not something to be so concerned about. But that is wrong. There are a number of important electrical diseases of the heart where the heart rate might go down drastically or might even go up very significantly. A normal person usually has a heart rate of around 60 to 100. Sometimes your heart rate might go down to the early 40s or even into the 30s. In such a scenario, obviously the amount of blood that reaches the brain and other parts of the body will be drastically diminished, and hence the oxygenation to the blood also or to the brain also goes down, and people tend to have blackouts. The opposite end of the spectrum is quite similar as well. If the heart rate goes up very high, maybe a 160, 170, and if the rhythm also changes, the heart just does not get a time to pump. While the first beat is occurring, the next beat comes in its place. Both of these conditions can be extremely dangerous and even fatal at times. So if you are getting symptoms like giddiness, recurrent episodes of something dark coming in front of your eyes, maybe even blackouts for a few seconds, do not ignore them. You have to consider these symptoms as important, and you should always get it checked out. The electrical system of the heart is a very delicate mechanism. It tries very hard to compensate for even small to even big changes, but at a certain point of time it cannot compensate anymore, and this is when the symptoms start. So the initiation of symptoms in such a condition is actually a red flag. There is something that we must always consider. There is no harm in finding out if there is disease. There is no harm in finding out if there is something wrong with us. Rather than having Damocles sword hanging over our neck and not knowing whether we actually have the disease or not, it is always better to get it checked out. It is always better to get it evaluated. When I was a resident, my consultant used to say this to me. If the first blackout occurs, do not wait for the second blackout to occur. Get it checked, get it diagnosed, and definitely get it treated. Thank you.